Good day everyone. It is nice to see you again. Welcome to our Any Learning, as our learning community. Lesson 3. Care of clients under emergency situation. CPR. Cardiopulmonary Resuscitation. Cardiopulmonary Resuscitation, CPR, is a technique of basic life support for the purpose of oxygenating the brain and heart until appropriate definitive medical treatment can restore normal heart and ventilatory action. It is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or triple chances of survival after cardiac arrest. The American Heart Association, AHA, develops science-based CPR guidelines and is the leader in first aid, CPR, and automated external defibrillators, AEDs, training. Why CPR is important? It is important because it keeps the blood flow active, even partially, thus extends the opportunity for a successful resuscitation once trained medical staff arrive on site. Indications of CPR are the following. 1. Cardiac arrest. And 2. Respiratory arrest. 1. Cardiac arrest due to the following. 2. Respiratory arrest due to the following. During assessment, you can observe the following: immediate loss of consciousness, absence of breath sounds or air movement through nose or mouth, absence of palpable carotid or femoral pulse, pulselessness in large arteries. Chain of survival. CPR is a critical step in the American Heart Association's chain of survival. The term chain of survival provides a useful metaphor for the element of the emergency cardiovascular care system's concept. The 5 links in the adult out-of-hospital chain of survival are: recognition of cardiac arrest and activation of the emergency response system, calling 911, early CPR with an emphasis on chest compressions, rapid defibrillation, basic and advanced emergency medical services, advanced life support and post-cardiac arrest care. A strong chain of survival can improve chances of survival and recovery for victims of cardiac arrest. Automated external defibrillators, AEDs. AEDs are computerized devices that are attached to a pulseless victim with adhesive pads. They will recommend shock delivery only if the victim's heart rhythm is one that a shock can treat. AEDs give rescuers visual and voice prompts to guide rescue actions. AEDs can greatly increase a cardiac arrest victim's chances of survival. The American Heart Association offers a 2-page guide on how to implement an AEDs program at a company or hospital to minimize the time to defibrillation for cardiac arrest victims. Deployment of AEDs should not be limited to only trained people, although training is still recommended. How is CPR performed? There are 2 commonly known versions of CPR. 1. For healthcare providers and those trained, and 2. For the general public or bystanders who witness an adult suddenly collapse. For healthcare providers and those trained, conventional CPR using chest compressions and mouth-to-mouth breathing at a ratio of 30:2 compressions 2 breaths. In adult victims of cardiac arrest, it is reasonable for rescuers to perform chest compressions at a rate of 100 to 120 per minute, and to a depth of at least 2 inches, or 5 centimeters, for an average adult, while avoiding excessive chest compression depths, greater than 2.4 inches, or 6 centimeters. For the general public or bystanders who witness an adult suddenly collapse, compression-only CPR or hands-only CPR. Hands-only CPR is CPR without mouth-to-mouth breaths. It is recommended for use by people who see a teen or adult suddenly collapse in an out-of-hospital setting, such as at home, at work, or in a park. Hands-only CPR consists of 2 easy steps. 1. Call 911 or send someone to do that. And 2. Push hard and fast in the center of the chest. About high quality CPR. High quality CPR should be performed by anyone, including bystanders. There are 5 critical components. 1. Minimize interruptions in chest compressions. 2. Provide compressions of adequate rate and depth. 3. Avoid leaning on the victim between compressions. 4. Ensure proper hand placement. 5. Avoid excessive ventilation. Thank you for listening. Have a good day and be safe. Agyamanag.